Thank you, everybody, for coming tonight. This is really one of our favorite nights of the year because we get to actually have a glass of wine with all of you and talk about what's happened over the past year and also what we're planning for the next year, which is really great. And as Dr. Wolf said, he and I started this years ago, and each year we add another person, another person, another person. It's been great. And everybody that's in UCSF in this room have been our greatest hires ever at some point, okay? And it's very much true. And they still, and this is, for our intents and purposes, this is still for us our MVPs. They're all our MVPs. And you're going to hear from every one of them tonight and kind of tell you about their passion, what their interests are, and where they're going with the research that's happening right now. There's no doubt about it that in today's kind of cancer world, there's this new buzz, this immunotherapy buzz. And it's great because at every meeting that I'm at, somebody treating another cancer or this cancer or that cancer, or they're always talking about how it's going better, they're doing well. And then somebody from myeloma, like myself, gets up and speaks and they say, oh, those myeloma docs, they brag so much. And it's great. And we're not really trying to brag. We're just trying to show how excited we are about what's really happening in the everyday research world that we're in right now. We have a great lineup tonight, and we also have, we're going to have a couple interviews for some of the patients that we've treated here. So thank you so much for our interviewees for coming and being here. We're gonna talk about a little bit about what's happened in their myeloma time, mostly their time at UCSF, and some of the treatment. You'll hear some of the treatments that went well, and maybe some of the treatments that didn't go so well. But they're here tonight because their last one has gone really, really well. Okay. And we like that, and that's great. But I do want to say, even that, we're just really at the beginning of all this. Part of this night tonight is for us to say, okay, here's where we're at, and here's where we want to be. And it takes a lot of things. It takes our efforts, all the efforts for the people that work here and do the research. It takes all of your efforts in what I always say, your blood, your bone marrow, your lip, your buccal swabs, all that stuff, that goes to research and is tremendously important for everything that we do. And we take it very seriously that we're here to make it better. Better for everybody in this room, better for people across the country, hopefully better for people across the world. I just got back from Bangkok, and I'll tell you a brief story about that. So it's. What's that? Yeah, exactly. Okay. All right, I'll change to the other one, okay? So it was at the Asian Myeloma Network, and the AMN meets every year, and they invite people over, and I've gotten to know them pretty well, and they keep inviting me back because one of the people from the International Myeloma Foundation say they trust you, they trust that what's happening at UCSF is real, and they want to hear about it and stuff, and it's great, and I love it. But I left Wednesday morning at 8 in the morning, and then when I woke up, after flying and then getting to the hotel and sleeping the next day, I went to the meeting, and they were getting ready, and I'm like, can you tell me what day it is today? Because I literally didn't know what day it is, okay? And that's only 2 days ago, so I still don't know what day it is, but that's all right. But it was Friday, and I thought it was Thursday, but that was okay, all righty? But at the end of the meeting, the goal was really to say, how can we get one CAR T-cell trial going in Asia? And so we're going to try to help. Myself, the people at UCSF, we're all going to try to get help, all righty? What they were impressed about, and what I'm impressed about too, is we have 5 CAR T trials going at UCSF right now. 5 trials. That's amazing, right? I mean, many places can't even get one trial up and going. And then we have, at each one of these tables, we have people that are doing research with the people that are undergoing those CAR Ts and research that we're doing with the blood tests and and the bone marrow tests, et cetera, that we're going to make it better. And it's already working quite good, but we're going to make it better. We said last year that we want to recruit some more scientists, and we are recruiting new scientists every day. One of the goals for us is to get a scientist here, another scientist here, that's going to help us make our own CAR T cells here and our own other immunotherapeutics. And we want to work, people have asked us in the past, well, isn't that kind of detracting away from the pharmaceutical companies and their energy moving forward? And the answer is no, it's actually working together with them. It's actually making it better for us. It's making it better from them. That pharma companies can't do all the stuff that we can do, right? And as a pharma company, when you're trying to develop something, you want to do it in the best possible candidates, right? Well, we have a lot of patients that are not the best possible candidates, and we still want them to have access to these things. So that's why we, in fact, can take back, Nina always says we're going to take back the car. Well, we're going to share the car, already. It's going to be like Uber car. It's going to be part San Francisco, part other places and stuff. But literally, we are trying to make it better, not just for the cream of the crop patient that can do it and everything's perfect about them, but also in patients that maybe are not as healthy, that can actually undergo this therapy and still become more healthy by doing it and making them better, which is great. We have several doctors right now that are scientists that are in the laboratory that are making CARs. August Dietrich, one of our newest members of our team, he's a fellow. And he's actually just joined 2 of the research labs that are trying to make new CARs, our own CARs for myeloma, and he's going to be the crux of bringing 2 labs together to try to take 2 technologies together to, again, make the CARs better. And I told him he can't graduate until he does that, okay? So don't drink too much wine tonight, okay? We're back in the lab tomorrow. And so, but literally, last year we began to fundraise to bring another scientist here that can help us make CARs in plasma cell disorders. And plasma cell disorders in my mind, includes a lot of things. It includes myeloma, it includes Waldenstrom's macroglobulin, it includes amyloidosis. These are plasma cell disorders that probably have the same targets on the cell surface. And these CAR T cells on a lot of these immunotherapies are actually targeting these proteins on the cell surface. And so the real goal is to again, include as many patients in this domain as we can. All right, we really want to make it better for a lot of patients. And in patients that maybe have a precancerous form of the disorder, that maybe we'll be at the point where we can make it go away before it becomes cancer. And wouldn't that be great? Okay, so last year we began this, and we began fundraising to bring a scientist here. We actually have done thanks to a lot of your help, we have done incredibly well. And our goal is still to bring that scientist here. We're close to our goals for bringing that person here. But when they get here, we always need more equipment, more machines, more investment so that they can do this not at light speed, but as fast as possible. And so that, again, that UCSF, we're already on the map, but we want to lead the map in this thing, which would be really great. Okay, and so with that as a start, I'm going to invite this guy over here, Dr. Wolf, back up, and he's going to go over the program review. So this is meant to be an open forum. Please feel free to ask questions to people at your table, to anybody up here at the podium. And also when we have our patient interviews, these guys would love to answer questions from you guys, et cetera. So, but have a good night. Thank you.